Thank you very much, and thanks to the three speakers for keeping such wonderful time. I would now like to invite questions, and if it's okay, we'll take 3 questions at a time and then ask our panel to feedback. If you could introduce yourself as you're making the question. We'll start here. Thank you.
I'm a veterinarian. So good initiative that you are supplementing the nutrition to the woman. This question to Gunrat ma'am. So a lot of good initiatives. We are also taking the same initiatives, supplying the backyard poultry to combat the malnutrition and also supplement the protein. I have seen the quantification, the number of eggs you have mentioned. I would like to know how much is exactly the protein or amino acid index supplied, so that we can compare with ICMR levels. We can say the data is accurate. Okay.
Grace Marquis from McGill University. I'd really like to thank Nilupa for her conclusions. As nutritionists, we are pretty good at estimating if we think there should be an effect if we give X amount of grams of iron or whatever. But I don't think we do the same for thinking about these integrated interventions. So her conclusion about thinking about did we actually give enough, I think is an important one, and suggests that we really need to bring on the business people who can look at the business model and say, is this going to be effective for these households? So I'd just like to thank her.
Good morning. This is Alessandra Gallier from ILRI. I also have a question for Nilupa. First of all, thanks everybody for the very interesting presentations. Nilupa, in your recommendations, you mentioned the need to move to a semi-commercial model of poultry. In our experience at ILRI, when we look at the gender component of intensification and commercialization, we find out that often women seem to lose control of the animals and of the animal products. And sometimes there may even be negative impacts on nutrition. So I was wondering, how do you combine the two? How do you think we should move towards a more commercial model, and how can that still be supporting of women's empowerment and nutrition? Thank you.
Hey, great. Thank you for all the positive questions and comments. In terms of protein contributions, so this is providing chickens that they produce eggs, and so you can just look at the quantity of eggs that are consumed. It's not so much chicken meat. So but as I was presenting, at a household level, there was very low production. So we didn't do quantitative dietary assessments on women or children. We just have kind of a 24-hour more of a food frequency type thing, looking really at dietary diversity. And we did look at individual foods, but you can kind of calculate if you have 4 eggs per week and 6 people and 7 days, the contribution really is not going to be that large. So yes, these questions about business models and really are we trying to have an impact? That's very true, and we do hear these. There's been a lot of evidence about when some of these interventions improve and become more productive, that women have less ownership and control over them, and they transition to their partners. That happens, but it's a tricky thing because, you know, if you're trying to improve the household diet, through what mechanism does that actually happen? And can you do it in a way that doesn't disempower women? I don't think I have a good answer for that. The intervention by ILRI did make a concerted effort to really work with women farmers and to think about that gender angle and really engage them in the technical support. So that part, I think, was helpful, but we don't have a good assessment of how successful that is. Again, we didn't take it to the level of production where probably that transition in the gendered control really did happen.
I think the sustainability model for what we are looking now, suggesting is introducing of puree. One of the things is so that different it can be served as input for different product. This is one of the suggestions. That the other thing is to have segregation of participant instead of for market, the better of household could be participate. For nutrition intervention, those vulnerable households to be targeted. This is one of the suggestions that we have.
Thank you very much. Just before we move on, I'll just take full advantage of being chair, and I'd like to have a question for Hassan. And it's indirectly related to your presentation. During the conference, we've seen a number of presentations that talk about red meat, concerns about red meat, and then we see an image of a cow. Your presentation demonstrated, at least in the area where you were working, small ruminants are very important to households. I'm wondering if you'd like to comment on whether you'd like to see more modelling in this sort of fora that actually takes into account the livestock that people actually raise.
Okay, thank you. As I did mention during my presentation, these small ruminants are kept for food and then cash, and in some cases for both reasons. And I remember one of my professors calls the goat the poor man's cow. So it would be good if we have more studies and models to look at these small ruminants, because they are affordable and they are healthier, and they are, especially the goat is disease resistant, and it can blend with so many environmental conditions better than the poultry. So if this is looked into, I think it will go a long way to help the poor farmers in sub-Saharan Africa.
Thank you. I think we have time for at least 3 more questions. Do we have?
Thank you very much. I'm Phil James from London School of Hygiene and Tropical Medicine. And just a question for Haile, please. I noticed the effect size of your child BMI score was quite strong and very significant. It was 3.1 units from end line to baseline. And I wondered if you could explain what that score was. I don't know if I got that, the BMI score. If you could give some insight on that, thank you.
I think SIP has already experience in different parts of in Africa, in Uganda, Malawi, Kenya. Pure is already versatile to be used as a raw material for it could be for bread, bakeries, for different as ingredient. So it can be stay as in a very proper way for minimum of 6 months. So that is one of the solution that we have tried to use sweet potato flour, but that was not sustainable. It's very expensive. It's very expensive. But puree, it can be applied within household with very minimal orientation. Just provide them simple orientation. They can introduce it with a local different way of. In Ethiopian context, you can use it in injera, bread, whatever. The only thing now to make it to commercialize, there is already developed technology by SIP nutritionist. This is one of the big breakthrough for next commercialization of orange flesh sweet potato in Africa and other African countries too.
Do we have any more? Sure.
Great, thank you. I actually had a question for Haile as well. And this is something I may not have just understood in your slide when you presented the results of baseline to end line and you saw a significant improvement in various outcomes. Was that just the intervention arms or was that also the control? How did the improvement in the control compare to the intervention?
In terms of methodology, as I have said, we have a control group and treatment group. We collect baseline data for both groups. At the same time, also a follow-up in-the-line survey for both control and target group. And then we look two difference within the group as well as with difference between the group, two difference. So that's what we, so based on that, we have found that there is significant difference in terms of diet diversity, in terms of milk, in terms of the egg consumption. These are some of the findings. Did I go to your...
Between baseline and final.
No, it's between the treatment and the control group. So we collect data for the treatment group as well as for the control group baseline and the line. Therefore, we have found two different. First difference is in the line, baseline for the treatment group, and then for the end line also, for the baseline also, control end line. And then there is two difference now, two different.
Any further? Yes?
Thank you. This is for Nilupa. Thank you very much again. If you were to design a new study focusing on the behavior change communication arm, do you have any lessons learned for how you'd improve that, or what would you change? Yes, please.
Oh, that's quite a question. Yes, it was very challenging. In this, we had a lot of discussion, and it's not we, it's really much the larger team about how to implement that across such a wide geography. There's ecological differences, there's cultural differences, there's a lot going on there. And we had a discussion of whether to have people who are specifically hired by us who are delivering these interventions so that we can really control and kind of be involved in how the intervention goes versus working through existing systems, thinking about scaling and where to go forward with that. And so we went with the latter. So that was why we worked with the IAR, which is the national agricultural body, to implement. And then the implementation within the country is kind of regional. So the supervision was really regional. It's very hard to just to look at the implementation side of things to maintain good fidelity and to just give the oversight that you would want to give. And something where all of these things are so multi-sectoral, someone who's actually delivering the intervention has to, be able to talk about nutrition, but also be able to talk about WASH and agricultural production and so many other topics, and not everyone is conversant on everything. So there are a lot of areas, again, not sure if I have good answers, but really I think if I were to do it again, putting as much resources as possible on the implementation side to really understand the delivery and how that interacts with people and how they respond to it and how fidelity plays a role in all of it.
Thank you. Well, I think we know we're getting close to lunch. In fact, we're right on lunch. I'd like to just leave one thought with you. This meeting has a strong nutrition focus. It has a strong human health focus. I don't think I've heard mention of animal welfare at all. We know that research is coming under increasing scrutiny, and I wonder if we had a research project with children where we started with 25 children and we ended up with 3, whether people might be a little bit concerned. So what we've seen over this week, and unfortunately what we see in a lot of projects, we come in with the idea that improved breeds are going to do well, but they only do well if you can meet all of their needs. So if we're sending these improved breeds out to villages and we start with 25 and we end up with 3, have we necessarily used the right birds? Have we taken care of animal welfare issues? And we know in Ethiopia, they've had poultry distribution programs for years. The government's been doing it. And you talk with households, they'll have their indigenous birds that they always keep, and they'll never say no to the new birds because there's always the pot or there's always the market. So I think there's a little bit of challenge to do a bit more work. And as we think about doing multidisciplinary work, do we also think about the ethics that cross from human to animal and also to environment. So happy to take your feedback on that over lunch. But before we go to lunch, please thank our speakers who have done a wonderful job.